Assalamu alaikum everyone. I'm Nadia Naeem and I'm a PhD scholar at University of Central Punjab. And today I will be talking about the course of treatment-resistant mood disorders, its clinical features, and what are the implications of evidence-based psychotherapeutic interventions. I will be covering these three parts, and the course will include both the manic episode as well as the depressive episode in treatment resistance. So the idea behind conducting this study was that mood disorders impose a huge medical burden, and when they become treatment resistant, that burden signifies. For understanding the underlying mechanism, we need to look what are the gaps that we are missing, and it is important because we have to suggest a suitable plan of action and. That action plan and what are the approaches that we have to use should be based on conceptualizing the longitudinal development of that treatment resistance in mood disorders or any disorder, but we are talking about mood disorders today. And we need to look at the related facets, the comorbidities, and the functional assessment among the patients who are suffering from treatment resistance. So we begin with the scientific definition that when we talk about treatment resistance, what we mean by treatment resistance. So there are two defining criteria for treatment resistance in depression and resistance in mania, and they are differently explained because the psychopharmacology is different for both episodes. So for treatment-resistant depression, it is stated that two adequate trials of antidepressants that have different mechanism of action on body, and when they fail and the client is non-responsive to those two trials, then the depressive episode or the disorder in general becomes treatment-resistant. And when we talk about mania, so the first line treatment is valproate, carbamazepine, and lithium. And when the maximum tolerance level is achieved and there is no response for at least 6 months and 3 times, that is covering 3 cycles, and specifically in absence of antidepressants or other cycle promoting agents, when there is no response for this treatment, then the manic episode becomes treatment resistant. Then we talk about what is the course trajectory and how the treatment resistance in mood disorders prevail overall. So it is more